Hi there, I've just gotten off the bus at Basin Road and I'm about to go to the Canberra Sexual Health Clinic to get my STI check.
Hello, this is Kat, one of the nurses. How can I help you today?
Hi Kat, my name is Zuleika. I was just calling to inquire about making an appointment with you guys tomorrow.
Sure, I'll just go through some questions with you and then we can look at booking you in. Just in the last 2 weeks, have you travelled outside of the ACT?
No, I've not.
Great. And do you have any current cold or flu-like symptoms?
No.
Excellent. Have you been to our clinic before?
No, I haven't.
Okay, no worries. So I'm just going to go through some questions so I can book you in at the right time. Just with your STI check, is it just a routine screen or do you have a symptom or concern today?
Just a routine screening.
Excellent. And when was the last time you had any sexual contact with anyone?
About a couple of weeks ago.
No worries, that's fine. We just need to make sure our testing is accurate in the right time frame, so that will work. I've got some appointments available tomorrow. What time were you thinking?
There's some time around 12 o'clock. What?
Yeah, that will be fine. I'll just pop you in here. All right, what's your first name?
Zuleika, Zulaikha,
And your date of birth?
the 2nd of December, 1998.
Okay. So if you just come to our appointment tomorrow, you need to come about 15 minutes before your appointment to fill out some paperwork.
Yeah.
Do you know where we're located?
No, I don't.
Okay, so we're in building number 8 at the Canberra Hospital on level 4.
Yeah.
It's a big building right behind the multi-storey car park on the hospital campus.
Yeah, awesome.
All right, we'll see you tomorrow.
Thank you so much. See you tomorrow.
Bye.
Hi, how you going?
Good, thanks yourself?
Yeah, good, thank you. You've got an appointment?
Yes, I believe at 12 o'clock.
Yeah, let me just have a look. What was your name?
Zuleika Noor.
Yes, I can see you there. First time to the clinic?
Yes, it is.
Perfect. I'll just get you some paperwork to fill out. So I'll give you this one. It's got just a self-history on there. If you just want to fill that one out in the waiting room.
Yep.
You're seeing Dr. Sama today in room 3. He'll be out in a moment to collect you.
Okay, awesome. Thank
Thank you.
Zuleika?
Yes.
Yeah, please come through. I'm Dr. Sana. Welcome to our clinic. Could you just confirm for me your full name and date of birth?
Yeah, Zuleika Noor, 2nd of December 1998.
Excellent. And what are your preferred pronouns?
She, her.
She, her. Excellent. How do you prefer we contact you about test results?
Phone number's fine.
Phone number's fine. Whenever we contact you with test results, it's always just going to be generic information, like your test results are negative. If we need to talk to you about something or get in touch, it'll just be a text that says, Zuleika, we'd like to talk. Okay?
Yeah.
Now, have you ever been to a sexual health clinic before?
No, I have not.
No. How did you find out about us?
I was just told from a few friends of mine that I should get regularly checked every 3 months or so, and since I've never done that before, I just thought I should give it a shot.
Excellent. So look, I'm glad you're here, and we want this to be a welcoming and open environment for our patients to come to. So like a couple of things I always go through with patients when they come to us for the first time. It's important to remember that what you discuss is confidential and private. The only time we share your information with other people is if you give us consent to do so, or if there's a safety concern. Okay. The other thing is, because we're a sexual health clinic, we do ask people questions about sex, about sexual partners, what kind of sex that they're having. Are you happy with me asking you some of those questions today?
Yes.
Excellent. Look, if there's any questions that you don't want to answer or don't feel like answering, just say pass. Okay, you've always got that right.
Yeah.
Okay. So Zuleika, start off by telling me what's your priorities by coming in today?
I think my priorities are just to make sure that my sexual health is all good, making sure there's nothing nasty that's hiding.
Okay.
Just want an overall checkup, basically.
Overall checkup. Are there any specific concerns or symptoms that you're worried about?
Not to my knowledge, but again, I'm not professional.
Okay.
You can probably spot things out that I don't know.
Okay. Rightio. Well, look, let's just sort of work through your form then. So, you've written down that you don't have any medical conditions, you don't take any regular medications. Do you have any allergies to medications?
No, not that I know
that's
of.
fine. Do you have a regular GP or a doctor you want us to copy into test results?
Yes, I do, yeah.
Okay, that's fine. So that's this Dr. Chan over here.
Yeah.
Yep, so we can copy them into the results. That's fine. Now, coming over leave, so you've written down your last STI check was about 3 months ago.
Yeah.
Do you remember if you got any blood tests done with that STI test?
Yes, I did.
You did some then. Do you remember what those blood tests were for?
I don't know. I just remember having to do a blood check, but like a blood test, but not quite sure what it is for.
Okay.
Yeah.
Look, one thing we do offer people, I mean, we have, general chlamydia and gonorrhea tests, which you can collect yourself, but we also offer testing for HIV and syphilis on blood tests. So is that something you're interested in doing today?
Sure, yeah.
Excellent. So we can do that for you. That's fine. Now, do you faint with needles? Or are you generally okay?
I'm good.
Okay. So we do all of that in-house here. So it's a little bit different to what you might have had in other clinics where, we'd hand you a form. Here we do all of that ourselves.
Yeah.
So basically we'd be doing a blood test for you for HIV and syphilis, and then I'll get you to collect a swab for chlamydia and gonorrhea.
Yep.
Okay. Now, in terms of results, so we get results back within about 7 days, but don't be surprised if we get back to you sooner.
Okay.
And more than likely, you'll just get a text message saying everything's okay.
Awesome.
Any other concerns that you wanted to talk about today?
No, everything sounds good.
Excellent. Now, in terms of follow-up appointments, obviously you can always call up in the future if you'd like to make an appointment here.
Mm-hmm.
Otherwise, I could book you in for 3 months' time if you'd like. What would you prefer?
I think I'll just call up whenever I'm available, yeah.
So if there's no other concerns, it's good to meet you today. Obviously, you can feel free to call up. My name's Dr. Sama.
Mm-hmm.
So you can call up the clinic anytime if you have any questions, and I guess we'll probably see you in 3 months.
Awesome. Thank you so much.
You're welcome.